Welcome to Copilot Podcasts. Picture this, an AI system just spotted a hairline fracture that 3 experienced doctors missed. Today, we're diving into how artificial intelligence is revolutionizing sports medicine and why it matters for every physician out there.
That's not even the most impressive part. Recent studies show AI-powered imaging systems are increasing diagnostic accuracy by up to 20% compared to traditional methods.
Wait, 20%? That's huge for patient outcomes.
Absolutely. And according to market research, we're seeing the AI in sports medicine market exploding from about $1 billion now to nearly $27 billion by 2030.
Let's break this down for our listeners. What exactly are we talking about when we say AI in sports medicine?
Well, AI in this context is really about machines learning from massive amounts of medical data to help with diagnosis, treatment planning, and even predicting injuries before they happen.
Go on.
Think about it like this. Machine learning algorithms can now predict injury risk with 85 to 90% accuracy by analyzing biomechanical data.
That's fascinating. How does that compare to traditional medical assessment?
It's interesting. Dr. Rachel Frank from the University of Colorado points out that traditionally, sports medicine relies heavily on patient history and physical exams.
Right, the classic what happened and what hurts approach.
Exactly. But now AI is enhancing that process. For example, deep learning models can identify fractures with 94% accuracy in emergency settings.
Let's talk about specific applications. Where are we seeing AI make the biggest impact?
The most immediate impact is in medical imaging analysis. AI can detect subtle fractures, soft tissue damage, and abnormalities that might be missed by the human eye.
And this is already happening in clinics?
Yes, and here's something surprising. These AI models are actually performing at the level of musculoskeletal fellowship-trained radiologists.
That's incredible. But I have to ask, should radiologists be worried about their jobs?
Not at all. AI is enhancing their capabilities, not replacing them. It's like having a highly skilled assistant that never gets tired.
You mentioned injury prediction earlier. How does that work?
Well, AI systems analyze thousands of data points, from an athlete's biomechanics to their workload history, to identify potential injury risks before they become actual injuries.
That's pretty amazing for prevention.
And it gets better. AI-driven rehabilitation protocols are reducing recovery time by 15 to 25% on average.
Hold on, that's a massive improvement for athletes.
It really is. And it's not just about faster recovery, it's about smarter recovery. AI can continuously adjust rehabilitation programs based on patient progress.
What about practical applications in everyday clinical settings?
One interesting development is in clinical documentation. AI is now helping with note-taking during patient evaluations, synthesizing the conversation into structured medical notes.
That must save a lot of time.
Absolutely. But more importantly, it lets doctors focus more on patient interaction rather than documentation.
What about accuracy? How reliable are these AI systems?
That's a crucial question. Research shows that for specific tasks like ACL tear detection, AI models are achieving accuracy rates comparable to experienced specialists.
Interesting. Any downsides we should be aware of?
Well, as Dr. Frank points out, AI shouldn't replace clinical judgment. It's essential to verify AI findings with traditional examination methods.
Makes sense. It's a tool, not a replacement.
Exactly. And like any tool, its effectiveness depends on the quality of data it's trained on.
Let's talk about the future. Where is this technology headed?
The most exciting developments are in personalized medicine. AI is enabling us to create highly individualized treatment plans based on vast amounts of patient data.
Can you give an example?
Sure. In rehabilitation, AI can analyze an athlete's movement patterns and adjust exercises in real time, something that would be impossible for a human therapist to do continuously.
That's incredible. What about challenges? There must be some obstacles to implementation.
The biggest challenges are data privacy, integration with existing systems, and ensuring healthcare providers are properly trained to use these tools.
Those sound like significant hurdles.
They are, but the potential benefits are too significant to ignore. 75% of sports organizations are planning to invest in AI and wearable technologies in the next 5 years.
That's a strong vote of confidence from the industry.
You know what's fascinating? AI's learning process actually mirrors how medical professionals develop expertise. Both improve with experience and data.
That's an interesting parallel I hadn't considered.
And just like medical professionals, AI systems get better at pattern recognition over time. They can analyze patterns across thousands of cases simultaneously.
Let's talk about cost. Is this technology accessible to smaller practices?
That's improving. Many AI tools are now available through subscription models, making them more accessible to smaller clinics.
That's encouraging.
And the return on investment can be significant when you consider the improved diagnostic accuracy and reduced treatment times.
What advice would you give to physicians who are hesitant about adopting AI?
Start small. Begin with one application, like imaging analysis or clinical documentation, and gradually expand as you become comfortable with the technology.
That seems like a sensible approach.
Remember, AI is meant to augment your expertise, not replace it. It's about making better decisions with more information.
Any final thoughts on the future of AI in sports medicine?
I think we're just scratching the surface. As AI continues to evolve, we'll see even more precise diagnostics and personalized treatment plans.
It's an exciting time to be in sports medicine.
Absolutely. And the real winners will be the patients who benefit from faster, more accurate diagnoses and better treatment outcomes.
Well, that brings us to the end of today's episode of Copilot Podcasts. Any last words for our listeners?
Yes, embrace AI as a powerful tool in your medical toolkit, but remember that it's meant to enhance, not replace, your clinical judgment.
Perfect. And remember that fracture AI spotted that 3 doctors missed? That's not the future, that's happening right now. Thanks for listening.